Hello everyone. Welcome to MDH clinical anatomy class. So, we completed upper limb, lower limb, important clinical classes. Today, we are starting thorax region or chest region. Okay, in the chest, what are the organs we have? Let's see first. So, mostly chest, or we can call respiratory tract. It have two parts: upper respiratory tract and lower respiratory tract. Okay, in the upper respiratory tract, it will start with nose and pharynx, larynx, and trachea. This will all come on upper respiratory. And in the lower respiratory tract, you have lungs. Lungs, right lung and left lung. In the right lung, you have three lobes: upper lobe, middle lobe, and lower lobe. In the left lung, you have two lobes: upper lobe, and lower lobe. So this is in the chest, you have respiratory tract, and another organ is also present in the chest, that is heart. So we will also discuss the important topics related heart also, which will come into our clinic or else like SOB, okay, and the chest pain. These are the two important cases which will come to into our clinic. Then afterwards, it will go to higher center. So how to examine everything we'll discuss. So today we're going to talk about chest. In the chest, we have respiratory tract. So respiratory tract. So we discussed that is upper respiratory tract, lower respiratory tract. In the lower respiratory tract, most common diseases like bronchitis and pneumonia. These are the most common clinical cases. Now, this is the some rainy season, so there are the chances of viral infection, bacterial infection, okay, and any protozoal back infection. So most common things nowadays: bronchitis and pneumonia. Or else in upper respiratory tract, you will get uh, cold and corsy, okay. Or else you can see cough. Cough is the common symptom. It is related to mostly lower respiratory tract. Cold, cold means I will discuss. Okay, here I will not explain. So basically, cough is related to lungs. Cold and corsy related to upper respiratory tract. Okay. So we have nose. We'll discuss all this thing in anatomy. Yeah, okay. Nose, pharynx, larynx, trachea, and lungs. These are the important organs related to respiratory system. Nose, pharynx, larynx, trachea. These are the pathway of inhaling the air. Okay, we inhale oxygen, we exhale carbon dioxide. Okay, so nose, these are the pathways. Okay, so in the nose, you have mucous membrane. In the pharynx, larynx, trachea, everywhere you have mucus. Why there is a mucus? In the lungs also, we have mucus. Why we need mucus? Because that to protect the organs from the infection. So mucus will the air when air passes, if any bacteria, dust particle, or anything is there in that air, it will attach to that mucus. Okay, then it will expel through the cuff. Okay, it is called reflex. What is called reflex? we have two reflexes, cough reflex and sneezing. These are reflexes. What they are called? They are called reflexes. The irritant or any particle or any bacteria, any virus is touched to that mucus, so it will want to expel it. Okay, so that's the reason our brain in the reflex area is mostly cerebellum. Cerebellum is the reflex area. Okay, so for cough and sneezing, okay, and is controlling power also, and as well as in the brain also we have, in the brain we have uh, small brain we call pons, okay, and cerebellum. Both have the respiratory area where the everything will control. Okay, so normal respiratory rate is 11 to 15 or sometimes 17. Okay, this is normal respiratory rate. How you will check the respiratory rate? You have to place a uh, hand on the chest, and you have to watch the time start, and when chest come forward you have to count one, two, three, like this you have to check throughout the 1 minute. This is how you check the respiratory rate. So respiratory rate you have to always check whenever a patient come with chest problem, okay, or sob or fever. Everything you have to check how is the respiratory rate. Okay, so these are the basic things related to thorax, and whatever important things will come underway, we will discuss that. So let's start the topic. First topic is bronchitis. Bronchitis. Okay, so bronchitis is the infection of the lungs parenchyma, means the functional part of the lungs. In the lungs also we have, what are those things? You can see in the lungs we have alveoli. These are the alveoli. Okay, alveoli is the functional unit where the exchanges happen. Gases exchanges happen. Okay, so these are trees, bronchi, sorry, bronchi, bronchioles. First you have bronchi, then bronchioles. Okay, these are the like we have tree. Okay, you imagine lungs are like tree only. Okay, tree. So it have stem. Okay, large stem and branches. First branch, second branch, third branch, fourth branch. In each branch you have single branches, small branches. So likewise, we have primary branches. This is primary. In the primary branch, you can able to see primary branch, secondary branch. Okay, secondary branch. These are the two branches. In the secondary branch, territory branch. Okay, three branches. One, two, three. In the primary branch, we have secondary branch. In the secondary branch, we have tertiary branch. So in the tertiary branch, we have bronchi. Okay. Here you have alveoli. Here you have alveoli. So bronchitis means inflammation of bronchi. Inflammation of single bronchi. It will start from here itself. Gradually, it will increase. Okay. So patient will have the cough. Okay, cough. Patient will have cough, like means with the sound of khar khar. Okay, it will have sound. He will you have to examine while patient come to your clinic, tell him to cough like that. Only air is coming, It is dry cough. In the bronchitis, we will get the sound khar khar sound because the mucous membrane and the bronchi are rubbing together. Okay, so there's the reason there is an a rubbing sound, khar khar sound. Okay, so and you have persistent cough also, swelling also, mucus also. Okay, because there is an infection. It may be bacterial infection, viral infection, or you have any type of dust allergy, or if a person smokes more, he will also develop bronchitis. Okay, it's a common structural change occurs. Reason may be different. Okay, this is the, you can see, uh, nose, pharynx, larynx, trachea. Okay, this is the trachea, and this has lungs. Lungs have lobes: first lobe, second lobe, third lobe, first lobe, and second lobe. Here you have heart, mediastinum, and heart. You can see primary bronchi, secondary bronchi. These are the territory bronchus. Primary bronchi, secondary bronchi. Here in left lung, you can able to see left lung is smaller than right lung. You can see this is the bronchi or bronchiole. You can see this is the mucus. This is the alveoli. Alveoli, air sac, like balloon. Okay, they will exchange the gases from here only. So here bronchitis occurs. Inflammation of bronchiole or bronchi, single bronchi. And it's also called chest cold. Okay, due to the viral infection. Okay, viral infection. Viral infection mostly reduces in 1 week to 3 weeks. Okay, maybe cough will come longer. Okay, it will come longer. If you can able to say acute bronchitis and chronic bronchitis. Chronic bronchitis, it may be due to the any other reasons also. Okay, it may be have productive cough. Productive cough and non-productive cough. Can anyone tell what is the difference between productive cough and non-productive cough? Hmm? Anyone? What is productive cough? What is non-productive cough? In bronchitis, you will get productive cough. Productive cough. Can anyone? Rajesh Saab, Irfan Saab, or else we have Pankaj.
Productive cough is present in saline type.
Hmm. Productive cough means having mucus. Okay, production is there. Production of mucus is there. Non-productive cough means no production of mucus, less production of mucus. Dry cough. Okay, when
Dry
the
cough.
dry cough, you will get dry thing, everything dry, dry mouth, dry throat, cough also. Soundy, large explosive sound of cough is there. Okay, in the chronic bronchitis, there is different reasons. It may be a COPD also, obstructive pulmonary disease, mostly in smokers. Okay, so we are not talking about chronic bronchitis, we're talking about acute bronchitis itself. You can see there are two types of bronchitis: acute bronchitis, chronic bronchitis. Symptoms. What are the symptoms? Cough. First is cough. Okay, bronchitis also occurs in TB also, because TB also a bacterial infection. Gradually, it will damage all the cell membrane and everything, the epithelial layers, everything. Okay, you have production of clear, white, yellow, or green mucus. Mucus is excess. Respiratory issues like SOB. SOB means shortness of breath. Dyspnea, also known as dyspnea, and wheezing sound. Krr, krr sound is there. Discomfort, tightness, pain in chest while coughing. So these are the just discomfort. Systemic symptoms. You have fatigue, headache, body ache, sore throat, slightly fever, cough, wheezing sound, sore throat, body ache, chills also is there, headache, nausea, vomiting, sometimes breathlessness. What are the causes? I told you most common cause of in the seasonal bronchitis is viral infection. Okay. Flu, cold, virus. Smoking also secondary for chronic bronchitis. Environmental issues also. If you travel in polluted dust or chemical substances will also lead to bronchitis. Is secondary. Other factors, low immunity or respiratory infection. And another cause is gastric reflexes. Gastric problems also cause bronchitis. Okay. So these are the secondary causes. You can see causes: smoking, chemical inhalation, pollution, infection, or inflammation in bronchi. How do you diagnose? So basically, you have symptoms, and we have the tests also. You have to see the structural issues. You have to get the scannings, X-ray, chest X-ray, pulmonary function test. You have to check the pulmonary function test. There is a inhale and exhale test where you can check the function of the lung. Sputum culture, if you have excess mucus, you have to check the sputum of the patient. It a bacteria or virus, anything. Blood test also, is the inflammation is there, means the WBC counts increase. Okay. Glucose, if there is any irritant or any allergic reaction is there, eosinophils or basophils count will increase. Lymphocytes, neutrophil count also increase inflammation. Okay, so you have to check that, and sometimes need blood test also. This is not required. Okay, bronchoscopy directly with the examination of with naked eye, you can able to see what is going on in the lungs. Okay, now along with that, practical examination is very important. I told you to check the respiratory uh, examination is very important. Now you have auscultation. You have the stethoscope. Now you have to auscultate your patient. Where do you auscultate? So best, the doctor will auscultate at the 5 to 6 regions. 5 to 6 regions. One is at upper lobe, place here, one upper lobe, here also, here also. You have to listen the sound of the lungs. Normal sound is like that. Some air is touching to leaves and it passes. This is the normal sound, like this. If any irritant is there, which is stopping the air to coming inside, there is an irritant which stopping the air from the inside to outside, means there is an obstruction. So obstructive sound you will hear in your stethoscope. You have to check upper lobe, middle lobe. Here there is no middle lobe. You can also keep auscultate here in the lower lobe, lower lobe. This is front area. 6 areas you can check the sound. Along with that, you have one triangle is there, backside. I will show you. This is called triangle of auscultation. Okay, there is a muscle. This is the trapezius, deltoid, latissimus dorsi, and you have another muscles here. This is the area where some space is there. Where there is some space is there, you can directly hear the sound of the lungs. Very clear sound. You have to practice this. Okay, this is the triangular area. Like this here, you can able to see. Like keep the hands of the patient like this. You will able to see the triangle of auscultation. What we will call triangle of auscultation, where doctor auscultate. Most of the doctors, pulmonologists will keep put their stethoscope. This stethoscope are very qualified and very uh, built, quality built. Okay, if from one sound they will able to understand how the lungs are there, how the structural changes are there. You have to hear the sound and imagine alveoli, is any problem in alveoli, okay, or any problem in bronchi, bronchioles, primary bronchioles and secondary bronchioles. You have to imagine and you have to connect with that with the scans, X-ray, CT scan. Okay, so you have to auscultate. Any other auscultation or areas also is there. I will show you. This is the auscultation, order of auscultation. For general examination, you have to keep, you see the upper lobe. You have to auscultate here, then 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 here, like this. You have to auscultate whole lung. Backside also start with this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like this, you have to check posterior view and anterior view of the lungs. Okay. No management. Most of the cases are resolved by own because of the viral infection. Gradually, it will decrease. But if any issues are there, we have to treat the patients. Here, antibiotic are not effective because it is not bacterial infection, it is our viral infection. So rest, taking rest, protecting ourselves from the cold water, cold air, or cold food. Okay, we have to take hot food. Okay, like egg, milk. These are the having energy. Okay, taking diet, hot diet also will leads to increase your immunity. Then immunity will uh, prepare a mechanism which will kill that virus or bacteria. So it is the good thing. Okay, whenever if any person is having mild symptoms, don't go for treatment. I think so. Take home remedies. If he have high symptoms or unable to control or other symptoms or need to take treatment, so then definitely he have to go to the doctor and follow his instructions. But simple symptoms need to take rest. Hydration is very important. Okay, and diet is very very important. Okay, if you are taking smoking, his patient is taking if patient is smoker, try to stop him from the smoking. Okay. Now electrohomeopathy treatment. So basically this bronchitis, inflammation, it may be infection. So basic remedy is P2, C13B, C13G. Okay. So if he have viral infection, bacterial infection, you can advise P1 Ver1. P1 will work on upper respiratory infections, P1 and P2. P1, whole P1. P3 is for children and for women. P4, non-resolving case. Non-resolving case. Patient is not getting relief, you have to add then P4. Or initially patient comes to your clinic by taking treatment from other doctors, then you have to add P4. Definitely you have to add P4. Okay, initially he's coming. So P2 C13B, P2 works on whole lungs, C13 will work on entire throat, nose, upper respiratory, BE for inflammation, for reduce inflammation. C13GE, it will work on upper respiratory tract and as well as cellular structures of the lungs. Okay. If you want to add here C1 or C2, is also good. C2, C13G. Or if it is infection, add Ver1. Okay. And it is not resolving, then you have to add Ven1 also. So C2, C13, Ven1G. In another remedy, you can add P1, P3, Ver1. So it will give good results. Okay, and along with internally add external remedy nebulization also required. So you have remedies P2, C13, Ver1. Initially give BE. Okay, inflammation will reduce. Or along with BE or GE, B along with BE, you can add GE also. Because BE will soft the mucus. BE will release the mucus. Okay. GE break the mucus. Okay, it will dissolve the mucus, and BE will remove the by cough. You can release the mucus. Ver1 will attack on the infection. C13 for structural issues, whatever structural damage happened there, you mutate C13. P2, this is the functional remedy of the lungs. Whole lungs will be covered under P2. So like this, you have to prepare a remedy. And if there is an issue of SOB or mucus, excess cough, you need to give remedy, continuous remedy, or you can tell rapid dose. You have to add rapid dose C17 L1 N1 WE, or else C17 A2 WE, or else YE if SOB is there. He's having SOB problem, C17 A2 YE. Or mucus is there, if you have there is excess mucus, C17 L1 N1 W. Okay. So this is all about bronchitis. So you can also follows home remedies also. Patient, tell him to take like what we have, adrak, ginger is helpful. Okay. And turmeric is also helpful. Okay, like this, home remedies along with electrohomeopathy remedies will work wonderful. Even only electrohomeopathy remedies also work wonderful. I treated, I remember I have one case, children, not he's a baby, 1 year, 1.5 year baby, suffering from bronchitis, SOB, severe chest suffocation, okay, and having temperature of 102, difficulty in breathing. So they went to doctor, pediatric doctor advised for admission. Okay, by taking X-ray, some pneumonia also started, but actual reason is bronchitis due to viral infection. So he started antibiotic also, it's not work. So later on they told to admit the baby. So they came to us and we treated with electrohomeopathy. Okay, rapid dose is very important, because if you want to control the symptoms, you want to control the patient condition, you need to go rapid dose. Okay, so here start with D6. Okay, in 2 to 3 days will take, and give in hot water. If the patient is suffering from cold things, you need to start with hot water. Other remedies along according to the diagnosis, pulse, tongue, and iris diagnosis. Okay, chronic cases have to be checked very carefully with other reasons also. Sometimes there is an issue in so okay, here it will confuse you. Okay, so just it's go through this with treatment, management, and other symptoms about bronchitis. I hope you understood about bronchitis. If anyone have any doubts, kindly ask.